Tell me something about yourself, mate. How on earth did you get into becoming a specialist in sort of medical cannabis and the likes?
My career in general practice is over 40 years, and back in the day we used to deliver babies, and then that all changed in the late 90s, and I joined the local CADS, Community Alcohol and Drug Services, and I was working mainly with people with alcohol use disorder, alcohol addiction, and after 15 years there, along the way, I learned about naltrexone and began prescribing that in 2010. But when medicinal cannabis became more readily available in 2017, I started the first medical cannabis service in the country.
And that's something that you continue to this day?
Yeah, look, most of my work, so I'm a GP, most of my work is medical cannabis. However, I did my training to be an addiction specialist, and I do see people, in particular, for naltrexone to help them control their drinking.
Okay, so let's go to naltrexone straight away. That was the drug that, as I said, there's an argument in Britain at the moment, which is interesting, actually, and I'm following Graham, that if it was prescribed on a much more regular basis, would reduce alcohol harm hugely, and would be have a good public health outcome. Let's tell us about naltrexone and what it does and what it is, please.
It's been available on prescription in this country since 2010. At that stage, the cost was about $12 a tablet, and some people were actually paying that because they were drinking alcohol to a much greater value each day than that. However, the price is down now to around $3 a tablet, but to get it fully subsidised, you have to see someone like me who works alongside addiction services, and I have to fill out something called a special authority form that goes to Pharmac, stating that the person is in a comprehensive alcohol treatment program, and that I am indeed who I say I am. I work alongside addiction services. So we fill this out online, get an immediate reply, and then I can write a prescription for the naltrexone.
Okay.
Yes, you asked how
do you
works.
accept?
Well,
it does work, does it?
Yeah. So it works in three basic ways. People report reduced craving, so they take the tablet every day, and the person that you described, possibly not unlike yourself, at the end of a hard day's work, come home and feel like a drink. If you've taken that tablet once a day, you will have less craving, so less thinking about drinking. We don't quite know how that works, but it's a definite effect for a lot of people. But for those who choose to drink, it helps them to find a stop button, and it works by activating what's called opioid receptors, and these signal part of the brain called the pleasure center. And so when we take substances that we enjoy, and that could be chocolate or alcohol or other drugs or even food or sex, our dopamine levels rise in the pleasure center, the nucleus accumbens. Now, naltrexone stops that rise. So a person might drink and they'll say they're not getting any pleasure from the drinking, or some will report that the alcohol just doesn't taste very good anymore, and that helps them to either stop after a drink or two or to avoid alcohol completely. So,
how effective is it? If you had to go on you'll have experience of, you've prescribed it over a number of years since 2010. What percentage of people would this generally work with in terms of breaking that habit?
I haven't done an audit of exactly how effective, but I get people started on this and see them after they've been on naltrexone for a month, and many of them report that it's been life-changing and wish to carry on, and some will carry on for months or years. But many people will shift from the idea of taking it every day, and typically 3 or 4 in the afternoon, as you can imagine, might be a good time to take it because it's most effective after an hour. But then people might just say, well, look, I've stopped drinking, but I'm socialising. I'll take it an hour before I go out to any risky situation where there's a lot of alcohol around, and that just takes away my interest, and I don't think about drinking while others are drinking alcohol.
You started, okay, so you personally are convinced of its effectiveness, which is good, obviously. You are the expert in this area.
It's a very safe medicine.
It's a very safe medicine?
It is. Very few side effects. Some people feel a bit sleepy, some people feel a bit squeamish, but that usually settles down after a few days. And really, it's so safe. All GPs should be able to prescribe it without having to go through this special authority. Think of the huge benefits, taking a tablet a day, the changes in people's lives and in their family lives. If they've been problem drinkers, and indeed taking a tablet a day can help to stop that, then you're making great benefits in families' lives.
No, and that was pretty much the argument of the Times over the weekend as well, when they were looking at it from the UK point of view. Graham, the other thing you've pointed out, though, is that your average GP can't prescribe. It's like, what, prescriptions of Rubifin or Ritalin for ADD, ADHD, is it? You've got to have a specialist who gets in to actually attest that this person needs that drug?
So I'm reading it from the website. I'm the applicant. I apply for the naltrexone. The applicant works in or with a community alcohol and drug service contracted to Health New Zealand. So most GPs are not in that situation. It seems like a very unnecessary barrier when GPs are prescribing much stronger, even more dangerous drugs. This is very safe as a medicine and has great benefits.
Can you explain to me why it isn't as available as you say it should be, and obviously the Times of London say as well? What's the problem?
Well, I think it was Pharmac when the cost was high originally, and they just haven't really kept up to date with the changes.
It's because $3 is not a lot, is it? Because as you point out, you'd be saving that and money every day, isn't it?
That's right. I guess Pharmac have got a lot on their minds, and naltrexone's a low priority, which is unfortunate.
Somebody's just asked, if it shuts down the pleasure centres, does it actually put you off sex, or is it just alcohol? Well, when it was first discovered in the 1960s, it was used for opioid addiction, so morphine, oxycodone, tramadol, codeine, etc. And then they found that it worked with alcohol. So here it's registered for use with alcohol. I've had a patient say that his shoplifting was controlled. I've had others say that, yes, sex may be less pleasurable, but I do ask patients, and most say, well, they weren't enjoying sex much while they were trashed on alcohol anyway, and life's a lot better drinking less alcohol. There is another drug that I understand, and I've come across, actually because it's a long story, but I have come across, it's called Antabuse, or I think it is disulfiram. And that's the one that if you take it, you actually vomit if you have alcohol. Is that right? Is that for a different type of person? Yeah, Antabuse disulfiram has been around a very long time. It works well for a lot of people, but if you've got an alcohol problem and can't stop your drinking, you have a glass or two and you know you're going to finish the whole bottle or the whole pack of beer, then you may not trust yourself to take a tablet that's going to cause facial flushing, headaches, nausea and vomiting that can go on for hours and may even get you in hospital. And so a lot of people don't like to take Antabuse. They just don't feel safe. Whereas naltrexone
does not cause those aversion effects, and people are much more willing to take something like naltrexone.